Hey everybody, welcome to another episode of the Global Health Impact Network podcast. I'm your host, Martyn Eeles. Today, I'd like to introduce everybody to Chris Pavlatos. He is the CEO for PatientMD. Chris, it's a pleasure to have you here.
It's a pleasure to be here, Martin. Thank you for inviting me.
Oh, you're very welcome. So why don't we kick off today with tell us a little bit about yourself.
Well, I live here in Chicago. I am a practicing physician. I'm actually a board-certified internist and orthopedic surgeon. I have been practicing orthopedics for over 25 years with the Illinois Bone and Joint Institute here in Chicago. I have an MBA from Northwestern's Kellogg's Graduate School of Business that I took several years ago, and I must admit it was one of the most enjoyable aspects of my educational career. Um, I'm a board member also of the Independent Physicians Association of America for the past 16 years. And as you mentioned, I am the founder and CEO of PatientMD.
So why don't you tell us a little bit about what is PatientMD?
Well, PatientMD is a physician-led organization that is an AI and blockchain-driven digital health platform that provides patient engagement solutions, chronic care management, and remote patient monitoring services for physicians as well as the healthcare business community.
Okay, but you had a very successful practice. So what led you to become an entrepreneur and start PatientMD?
Yeah, I have a few people that have asked me that same question, but I saw what was happening over the past 10 years here in the US market. Hospitals were consolidating into very large health systems. And what became frustrating to me is that I saw a lot of physicians' practices, and now it's up to 50% of physicians' practices, are owned by these large health systems. And physicians sold their practices primarily out of fear that they would not be able to compete. Obviously, private practice physicians don't have the same resources that the large health systems have. So physicians wound up selling their practices, and that was very frustrating to me. And if you wanted to sell, I thought that was fine, but they did it primarily out of fear. And those that have sold their practices, some recent studies have showed that over 70% of those physicians that have become employed in these large health systems are not actually happy. And if they had the chance, they would leave and go into private practice. But there was not another alternative. So I looked at the market and I was fearful of seeing private practice go away. As a private practice physician, I wanted my colleagues and my profession to be able to support private practice, which I feel is extremely important. If it went away, we would be left with corporate medicine, which certainly is not good for our profession and it's certainly not good for our patients because I think you get a higher touch of care in the private sector. So this led me to start a company to see what I can do to help support private practices so they can grow and compete against large health systems.
Perfect. So can you tell us how does PatientMD help the physician community and their practices?
Yeah, well, we do a number of things to help them, but and we would when we first started out with my co-founder Anirban Manjumdar, great guy, brilliant guy who I've known for over 14 years. We first looked at the market of how can we help the physician, and that you had to answer the question is where do you think competition will occur between physicians and health systems? And our approach is that the competition will occur in three key areas. One is the ability to engage the patient. Patient engagement is going to be critical because we're moving in a consumer-driven marketplace, and your ability to engage that patient is absolutely critical. We don't see the loyalty that patients had with physicians in the past. Patients are now over 70% of patients are using online tools to make decisions of which doctor they go to. So who can deliver them the best service at the best value is what makes a patient go to see a physician. The second area of competition that we saw was in the cost of care. Who could compete as far as cost goes? And this is extremely important. Obviously, here in the United States, the cost of care is just continuing to escalate 2 to 3 times the rate of inflation, although inflation now has gone up quite high. So cost is a big factor. Healthcare represents 20% of our GDP, and it's a large $4 trillion industry, and there's no end in sight as far as the rising cost of care. The third area where we felt competition would occur would be in care coordination for chronic care management, because 75% of healthcare expenditures occur in this population that has multiple chronic diseases, who often go to different providers at different institutions. So the ability to care coordinate for chronic care management, we thought, is going to be critical. Now, in order to compete, we felt digital health technology is going to be crucial for that. Now, for most physicians, our passion is to take care of patients. Most physicians, we don't have the knowledge from a technical aspect on what technology we need, who do we get it from, how are we going to integrate all this technology into our practice where we become more efficient, and it's done in a cost-efficient manner. And then if were able to do that, you don't have a tech team to support it. And second of all, then you're still fragmented, you're still isolated, and you're not connected with anyone. So that provides you limited value. So that led us to build a cloud-based mobile platform known as PatientMD that provides multiple patient engagement services. And they're built in modules, or what we call microservices, that are used to assist the physician in their ability to, one, compete against health system, both in their ability to engage patients and also compete in the cost of care. So by providing a single platform with multiple services that are fully integrated into one single platform from one organization that is physician-led, whose goal is to help and support private practice, we think provides enormous value to the physician. So we provide all these services that allows you to engage with your patients so you can grow your practice. One of our services is a marketplace where you can now start posting your prices, which is going to be extremely important moving forward for growth in private practice. We all know federal policies now are going to mandate price transparency, and all your prices are going to be out there. In fact, the payer community starting next year must tell the patient what the cost of a service will be from whatever provider they go. And they must also inform them what their deductible is, what has been met at that date, and what the cost will be to them at the point of service. So exposing your prices is going to happen, and we need to leverage that and use that to our advantage. Why? Because private practice physicians provide care at a lower cost than what you would receive from a hospital-based system. So there's a distinct advantage. So we built one single platform with multiple patient engagement tools to attract patients to your practice. We show the value in the cost of care because you're lower price, so you provide more value to the patient. The one area where we saw physicians had a problem in private practice is in care coordination. We're a fragmented industry, especially in private practice. We're not integrated or connected with a lot of the other practices. We're very inefficient. This is where health systems certainly have a distinct advantage because they have multiple physicians on one information system, so they have a common means of sharing information with common messaging. So in order for private practice to compete in this area, we felt that it is absolutely critical that we start forming communities of physicians or a network of physicians within local markets. So we built a sophisticated integration engine that allows to be able to gather data from your EHR and be able to share it and integrate it with other doctors' EHR, so you have the ability to care coordinate. Now, on top of it, we provide a very common messaging platform. So not only can you coordinate care and share information, but you have a common messaging platform, which is absolutely critical for patient care. And when you provide all this, the experience then to the patient is a very good one. So not only can you now engage with your patients, not only can you provide services at lower cost comparable to a health system or better than a health system, but now you're able to coordinate care equivalent to a health system because we form communities of doctors where we share information with common messaging, which makes you more efficient and ultimately improves patient care. And it's been shown that This care coordination with common messaging is extremely important. One, in improving the quality of care to our patients. It's extremely important in reducing costs and reducing duplication of tests. And it's ultimately extremely important in reducing medical errors. And there was a recent study not too long ago from Johns Hopkins that showed that medical errors is now becoming close to the third leading cause of death here in the United States. So what we do in our platform, to summarize, we do several things. One, we help physicians grow their practice through patient engagement and recruitment services that we offer. Two, we provide engagement of their new and existing patients with their practice, which is extremely important because 10 to 15% of patients leak from one practice, go to another. So you want to maintain those patients within your practice. We improve your front office efficiency with all the different services we provide, and we provide the connectivity for information sharing and messaging such that you have the capability of care coordinating and improve the patient's experience. Now, in addition to providing these services to physicians, the private sector and the healthcare businesses also need similar services, both from physical therapy, labs, imaging facilities, pharmacies. They too have to be able to provide patient engagement services. They need to stay connected and can be able to message with their customers. So we offer that type of platform to them also. And the ultimate goal is to begin eliminating the fragmentation of this industry and creating a collaborative healthcare ecosystem.
That's awesome. So let me ask you this: what's your overall vision for PatientMD?
Yeah. So what I describe, what I consider is the short-term aspect of PatientMD. What we're doing first is grow physicians' practices by engaging them with their patients. So ultimately, we feel healthcare is going to the ultimate of patient-centric, value-based care, which is precision medicine and personalized healthcare. That is where we feel the end game is. That's exactly what patients would want. What do I need to do to be healthy and stay healthy, specific to me? And this starts out, we accomplish this in a 3-step process. The first step, which we talked about, is engagement. Our goal is to engage physicians by providing them enormous value through this platform, which allows us then to engage with their patients. This gives us the capability of capturing both clinical, genomic, and IoT data that creates that longitudinal health record of the patient, which the patient will have access and control of that data on who can use it. And as we gather that data, we then empower patients and physicians by using clinical decision support, predictive analytics, and artificial intelligence to be able to educate the patient and the doctor on precision medicine and personalized healthcare. And then we use what we call prescriptive analytics, where based on your information that you have, we provide you through the marketplace what products or services you may need to improve your health and healthcare, and do it in a transparent fashion where you know what the cost is and the quality of those services. So we engage and we empower. But as physicians, we also know that sometimes we could talk till we're blue in the face and tell patients what we need to do, but they don't always do it. So we built an incentive program into our platform where we help incentivize patients and begin to gamify the industry. And we're going to be doing this through a token. It's going to be a stable ERC20 utility token that will be priced at $1 per token. All the funds from the token go into an escrow account. They're invested in some very low volatility funds, so they have the ability to earn some interest. And the purpose of that is to maintain the floor of the value of the token at $1, where it will not go under $1. Well, in this fashion, patients then, we use it in multiple means, the token, but one example from the patient side, it's an incentive token. So for example, if you're a diabetic and you have abnormal values, but with the appropriate treatment and actions on the part of the patient, if you get an ophthalmology consult per year, if you see your podiatrist, your hemoglobin's A1Cs turn to normal, through your payer or your employer, you can be rewarded through a smart contract on the blockchain with tokens automatically into your digital wallet that we provide. So patients then earn something of value. Those tokens then can only be used on the platform for additional healthcare services. What's the value of that? That further engages the patient in their health. And we all know that the more patients are engaged, the higher the quality of care at lower cost. So that's where we feel is our long-term vision where we're going.
I love that. But you're also working with Dr. Gary Goldman and GHIN. So what's your relationship with them?
Yeah, Gary and I, it's interesting. We met about a year and a half ago, and we met on LinkedIn. We had people in common, and we hooked up with each other and realized, like, hey, you're doing something that I like, and he was doing something that I like. So we decided to get together. We talked one day, and the first time we got together on a call, I think it was literally a 90-minute call. And what was interesting, we had the same vision. We believe in the same thing. And it almost felt like we were finishing each other's sentence every time we were talking. We were just right on the same page. And we both felt that something needs to be done for our profession and done for the physicians. And we need to help and support them, which we don't think people are doing. They're leaving us out. And we felt that ultimately to really help the physician and solve the problems in the industry, it really requires a collaborative healthcare ecosystem. And we felt that a physician-led organization is absolutely critical for this, because as physicians, we think we have the trust that the patient wants. And as a physician-led organizations, we think we could provide the trust that physicians want too from the people that they work with. Excuse me. And this is ultimately to provide this healthcare ecosystem to deliver precision medicine and personalized healthcare. So, and the way you do that is through this collaborative community with different partners. We create interoperability to create that longitudinal health record of the patient, which the patient controls. Leverage digital health technology, especially telehealth, which is going to only grow moving forward, especially in chronic care management and remote patient monitoring. And create a network that's transparent on cost and quality. We feel though that type of environment will certainly create enormous competition and allow the free market system to really work, where innovation can occur within this network such that we can ultimately improve the quality of care and at a lower cost. And we also looked at this partnership with GHIN as important because it would provide us global expansion for our patient engagement solution, as well as for our marketplace. We plan with GHIN entering into the medical tourism business. So through the marketplace, we will be able to offer patients services from all parts of the world. And we all know that the medical tourism business is projected to be over a $165 billion industry in the next 5 years. So this led us to working with GHIN, provide us good expansion and provides value to each other. And we have a very strong partnership, and I think that partnership will only grow moving forward.
Yeah, well, it's clear to me like you have a very exciting venture with enormous possibilities. Now, I understand you're currently going through a capital raise as well at the minute. Like,
Yes.
how can investors participate if they're interested in this raise?
Yeah, so what we're doing is we're looking to raise $2 million. My co-founder and I, just to give you a little background about my co-founder, Anirban Majumdar, he's been a friend for 14 years. He is a graduate from IIT in India. He has a master's in computer science and an MBA from the University of Chicago. He is a Silicon Valley veteran who's been there for over 10 years. Enormous, just a really smart guy. Together, collectively, we put $4 million, over $4 million capital into this company to build this extensive platform for the marketplace. And now the technology's there. It's been built. Now we're ready to scale the company. So we're looking to raise $2 million to scale it initially. All the funds will be used primarily for business development, marketing, and sales capability. And we're raising the $2 million in the form of a SAFE, which is a simple agreement for future equity. We're providing a 20% discount to that SAFE that will be sponsored through GHIN and managed through CARTA, which is an organization that manages all this. So if people are interested in investing in a project that has enormous potential, especially with the partnership with GHIN, you're more than welcome. Please contact me. You could contact me at Chris, that's CHRIST with a T at the end, at PatientMD.com. So that's Chris, CHRIST at PatientMD.com.
Perfect. Well, Chris, I got no other questions for you. Is there anything you'd like to add?
No, I just like to thank you. And I like everyone to also get involved with GHIN and support this organization, because I think we're creating a very powerful movement together to bring the physician community together, both not just from a national perspective, but hopefully from a global perspective, that will allow us to democratize healthcare and be able to deliver healthcare, higher quality healthcare across the world, where areas where they're currently being underserved.
Perfect. Well, you heard Chris, everybody. Join the Global Health Impact Network. Chris, it's been an absolute pleasure. Thank you so much. And again, I'd like to thank all our listeners as always. It means a lot to us that you listen to these. And I'll see you all next time. Bye-bye.
Thank you, Martyn.